Hello, everyone, and welcome to the Shine Connect session on fatigue. We're really excited to have two great speakers with us today, Anna and Julie, who will tell us a little bit about themselves in a minute. We've got about 20 to 30 minutes of a presentation today, and then we'll be going live to Q&A, so please join us afterwards. This is a really important session because we know that fatigue is one of those things that affects so many people with cancer, particularly young adults who, are really struggling to get back to the lives that they were living before. So thanks for joining us. And I am going to hand over to Anna. Anna, welcome.
Thank you very much, Kainran, and thank you so much for inviting us to do this session on fatigue. So yes, as you said, my name is Anna Spathis. I'm a consultant working in the NHS and in Cambridge University, and most of my work is about fatigue and also the other symptom, breathlessness. And we've specifically been doing research on the topic of cancer-related fatigue in young people. So it's very exciting to be able to be here today. Julie.
Thank you, Anna. So I'm Julie, and I'm an occupational therapist also working in the NHS. And I've got a particular interest in working with people with cancer-related fatigue also, and facilitate fatigue management workshops locally for people of all ages. And from the work we've been part of, we know that nearly everyone experiences fatigue to some degree. And although this is our work and we base our interventions on the evidence available, we also learn so much from people like yourselves. So we're very aware that we really are talking to the experts in managing fatigue. You really are the experts.
So Julie and I, in our double act, want to divide this session up into three parts. The first is about what is fatigue, its enormity, its impact, a bit about why it happens, and then the main focus of this session is going to be on what people can do about it, small and simple things that do make a real difference over time. So in the first bit, what do we know about fatigue? The first thing to say is and so many of you listening to this will know this, but it's not the usual tiredness that people talk about. It's so much worse, and it doesn't go away with rest or sleep. Yes, it affects the body. People talk about it like a ton of bricks or wading through cement. But actually, it's the fact it hugely affects the brain as well. People often don't realize that. Memory, concentration, how sharp the thinking is. And this has a massive impact, particularly on young people needing to use the brain so much.
And some people have mentioned that they will read through, say, a page of a book and then have to go back as they haven't really taken anything in, or they're just nodding when people are talking because they're feeling so overloaded with the conversation.
Another feature of fatigue is just that it can't be seen. I'm sure this resonates with those of you experiencing fatigue. It's invisible and it varies day to day, and this can lead to misunderstandings, even tensions with family, with friends, people at work. It really can have an impact on relationships, on social life as well.
One of the biggest frustrations that people report is when other people say, oh, I know how you feel, I've had a long day too, but this isn't usual tiredness, it's very different.
Now, another thing that so many people talk about is just how long-term the restriction can be. This length is a big problem. Horizons suddenly become tiny at a time of life when people are actually wanting horizons to be opening up. So, there's all the hope of perhaps being given the all clear with cancer, and yet people are living with this huge, like an overhanging problem of fatigue that just keeps going.
And it can feel a bit like taking one step forward and two steps back. As Anna said, often the treatment's complete and given the all clear, but the fatigue is the overhanging problem.
And just to cap it all, fatigue, I don't know if you're aware of this, but fatigue is actually the very commonest symptom that people experience during and after cancer, more than pain, more than nausea, bowel problems. And of all the different age groups, cancer-related fatigue is worst in younger adults, more than in older adults and more than in children. So everyone experiences it at some point. It's almost ubiquitous, for example, during cancer treatment. And 1 in 2 people in general experience it longer term. So what are we saying? If you are living with fatigue, you're absolutely not alone, even if it does feel like it sometimes.
So it can really feel like belonging to a club that you didn't really want to join. And this quote came from the following video in which we worked with a young lady called Faye, together with Macmillan. So we're just going to share the video with you.
Yeah.
When I first started having chemo, I would say I got quite heavy fatigue. It was kind of like a build-up, so I would kind of get through tiredness, and then all of a sudden it would hit me really hard, and I'd just have to have a day of literally sleeping and resting. 2 months into my treatment, I got told I was cancer-free, so I had another 4 months treatment left. You knew that you didn't have cancer in your body, but you had to go through something really, really tough. And I think that really mentally fatigues me in terms of me wanting to get to the end, but not being able to get there. After treatment, you're still getting the tail end of fatigue. It was quite hard for my family to kind of decipher whether it was just me being a normal teenager.
Yeah, teenagers and young adults are moody anyway, aren't they? So to have the added fatigue and the added complications of having chemo and what you're going through, the ups and downs of that, it was, you know, I thought it was incredibly difficult, really. Looking back, it might be a good idea to have had some more advice about it, to highlight the fatigue thing, because I didn't realise it was going to be such a big thing.
It was hard to kind of explain. You're not going through treatment anymore, like the fatigue shouldn't be there. I think, you know, once it's finished, people like to just forget, and to be fair, like I wanted to just forget, but it's still there and it's still a thing that we need to combat and that we're trying to get through. Getting cancer made me realise that I wanted to do something that I actually enjoy, so I kind of looked into studying fashion. I applied for Central St Martin's to study fashion history and theory. A few months after I'd finished treatment, I found out that I got in. It kind of felt really special to me. Central St Martin's is amazing. I love it. I felt like I was going to start my career and my life before I got diagnosed. I feel like I'm properly starting now rather than then. My advice for other young people experiencing fatigue would be movement and exercise, even if it's something really, really small, like a walk around the block or literally standing in front of the TV and marching, which is what I did actually quite a lot. That movement and exercise, I think is good mentally and physically. I had to kind of plan things in terms of when I would have a good day, because you knew that after you'd had the chemo, that weekend and days after that were kind of a write-off. Once you create the routine, I personally felt that I could do things on certain days.
So Faye there has articulated, I think, beautifully many of the things that Julie and I have been talking about so far. And she also gives some tips about things that helped her move forward. And we'll come back to these kind of practical tips and techniques. But first, we want to consider our second question, which is, what do we know about why fatigue actually happens? So a big part of it, and we're calling this layer 1, is thought to relate to inflammation. This isn't like you might say, I don't know, see inflammation on your skin, but it is similar chemicals, they're called cytokines, that circulate around the body rather than just being in one place. That's called systemic inflammation. And these chemicals are particularly released by cancer treatments, which is why there is this big association of fatigue with treatment. And Faye mentioned her fatigue being so bad around that time. That might be your experience as well. Now, fatigue is complex because as well as this inflammatory cause due to the cancer or its treatment, there's also another layer on top of that. When we're fatigued, we have these instinctive responses to that feeling of fatigue. But the problem is that these actually can inadvertently feed back and worsen the fatigue even more. So it's like feedback loops that can lead to vicious cycles. Now, this model, the sleeping thinking activity, or STA model, has come out of our research working with young people who are living with cancer-related fatigue. So this is what they were explaining to us, and all we've done is sort of conceptualized it. And essentially, this model shows 3 of the main feedback loops, which go round and round and can cause vicious circles. So let's just have a quick look at them. Let's start with activity. Fatigue enforces rest. We all know that. It's so difficult to be active. But if we are less active, we get less fit. And this means that muscles work less efficiently. And once muscles are working less efficiently, fatigue can become worse. It's just normal for that to happen. Thinking about the thinking vicious cycle, when people, if you're feeling misunderstood or really restricted, it's so normal for that to lead to feelings of anxiety, frustration, stress, but that in turn can make the fatigue worse. So, if your muscles are tense with the stress of it all, the use of the muscles actually contributes to the exhaustion. And then thinking about the sleeping cycle, when people are fatigued, it invariably has an impact on sleeping patterns. For example, needing to nap during the day, or maybe people use electronic devices which emit blue light, which keep people awake. So all of this can reduce nighttime sleep, both the length and the quality of it, and so worsening with fatigue. One of the young people who was helping in our research, he said, fatigue breeds fatigue. And I think that really sums it up. So what's the point of all of this? So what? What's the meaning of it all? I guess the bad thing about these feedback loops is that they can spiral and get worse and worse. And so even after the trigger has gone, say it was the cancer treatment, the spiral can continue and make the fatigue carry on longer term for some people. The good thing, if I can put it this way, about these spirals is that they can be broken. And they can be broken often by something quite small. And this is actually how the practical techniques that we're going to be talking about work. Those things like Faye mentioned, the moving, she was planning her day, having a routine, and so on. So essentially, thinking about it this way gives us a way in with treating fatigue. It means there's always something that can be done. Even if we can't change layer 1, if that makes any sense, there's still layer 2, breaking those feedback loops. And also the types of approaches we're talking about are simple and safe, which is more than we can say for many medicines. And really importantly also, by breaking a vicious cycle, so here's some scissors, breaking the vicious cycle, we can turn the downward spiral into a cycle of health improvement. In other words, a small change to break the cycle can actually lead to a very big improvement, because you get this sort of virtuous cycle of things getting better and better. So overall, what have we said so far? Fatigue is complex with many contributors in these different layers that we're talking about, but it's kind of positive in a way, because it gives us ways in, many ways that we can tackle fatigue as we work together to try to control the symptom. Okay, so going on now to the core bit of what we want to talk about, and probably that you're interested in as well, which is how can I manage my fatigue? And we like to think of this as balancing activity with conserving energy. So this is the ABC of managing fatigue. And Julie now is going to go into some of the details of this, starting with A for activity.
Okay, so we've chosen the word activity purposefully and not exercise, not just because it fits with ABC, but also because any activity is really helpful in managing fatigue. So what the things that you enjoy, the things that you would like to do. So it can be walking, dancing, gardening, or something like yoga, for which there's particularly good evidence that it helps to improve cancer-related fatigue. So the important points really are trying to establish your own baseline. So trying not to be too concerned with what everybody else can do, and also establishing what your baseline is now. So what your current baseline is, and working up from this point. So we would usually suggest trying to build up by around 10% each week with whatever you're doing, whether it be walking or doing other kinds of activity. And over an 8-week period, your activity will double with this 10% increase. One of the challenges with activity, though, is not overdoing it. So trying to avoid this roller coaster, really. When you're having a good day, it's really natural to try and do as much as you can, especially when you're not sure when the next day is going to come. But this can lead to big ups and crashes down, which may be really familiar to you, unfortunately. And this is the concept, really, of boom bust. So boom bust looks a little like this. You go all out on a good day and you're feeling good and you want to do as much as you can. And then the following day, your energy levels crash. So you need that recovery time and you feel that bust. And then the next day you continue. So you try again to do as much as you can, but the following day you need more time to recover again. And if this pattern continues, you end up being able to do less activity each day, but requiring more recovery time. So it actually worsens the fatigue over time. And the body doesn't generally like this boom bust pattern. It prefers a much more even level of activity, which helps to sustain energy levels and also build them up over time. And it's difficult to avoid this boom bust all of the time, because sometimes life means that we have boom bust. If there's a particular event on at a weekend or something that we're going to do, invariably you're going to go all out on that weekend. But if you can avoid it being the normal pattern of doing things, this will really help with improving fatigue. So we've looked at the A of activity. Let's move on to the B, so finding that balance. So finding a balance between activity and conserving energy. And also using some rest to avoid that boom bust that we talked about. Often people say to us, like, on the one hand, you're suggesting that I keep active, and on the other hand, you're telling me to conserve my energy. So which is it? It can feel like a contradiction, but actually they're really complementary, because activity enables the body to be as fit as it can be and to work as efficiently as it can do. And conserving energy is using the body's energy in the most efficient way. So we're trying to find that balance, and that's really enabling your body to work in its most efficient state. So let's move on to the C of conserving energy. And it can be helpful to think about these 5 Ps or principles of conserving energy. So planning your day and your weeks well, with a balance of activity, that balance that we talked about. Pacing, it's better to take a little extra time to complete a task and be able to continue, rather than try and finish something really quickly but feel too tired to do anything else. So pacing can be really important. And then prioritising what's important to you. And we like the idea of delegate, ditch and do. So what kind of things can you delegate to someone else to do? What sort of things really aren't important and you can ditch them? And what things can do you want to do, or do you need to focus on? And it's okay to say no, and it's okay to ask for help as well. I think often you feel like you need to keep going with everything. With posture, that can be important also to consider. So trying to avoid excessive or repetitive bending or twisting, which just wastes energy, and thinking about the environment around you, whether it be your work or home environment. And probably the most important thing is permission. So allowing yourself to do things in a different way, and allowing yourself to make small changes to established habits as well. So really giving yourself that permission to do things differently. And this can feel like common sense. It can feel like common sense things, but when we're not really used to thinking about our energy in this way. So it can be useful to give it some conscious thought and give these principles some conscious thoughts. So how can we do this practically? What can we actually put into place to help to do this? So we're now going to share some tools that people have found helpful in conserving energy. And one of the first things is the activity diary. So With the activity diary, people consider how much energy each activity they do will cost them in terms of energy. So thinking about things in terms of high energy and low energy activities and those restorative activities, and then colour coding them. So we've got here the red, the yellow and the green, can help to identify how much time people spend on each type of activity and help to get that balance that we talked about. So the kinds of activities that are high and low energy, or those that are restorative, will be different for everyone. So where talking to family and friends might be low energy for one person, that might actually be a high energy activity for somebody else. And the following slide is an example of how someone that we've worked with used the diary to change their activities to help with their energy levels. So on this first meeting, or when we first started working together, you can see that this person has filled out the diary. There's lots of big blocks of red, so high energy activities kind of all lumped together, limited yellow, which is the low energy activity, and nearly no green. I think there's one bit of green on there, which is the rest. So this person was really fatigued, and this really identified that boom bust pattern of activity, really going all out, and the blue is the sleep. So they were just basically activity and sleep. And then the next time we came to meet up, after looking at some of those principles we talked about, the following week there were less blocks of red and more yellow in there, and certainly some green interspersed there as well. So regular time for rest or effective rest. So there was a bit more balance, and he had noticed some improvement in his fatigue. So these diaries can be a really helpful tool and can also be more individualized. So we had somebody who added in a gratitude exercise where they thought of one thing each day that was going really well for them, or that they were really thankful for. And people have also found these really helpful to inform discussions with employers or with GPs, as it gives a really visual account of the day and helps others to understand something that's not easy to explain. Another helpful tool in managing energy levels can be to think of the activities that give you energy and those that deplete your energies as well. So these will be different for all of us, and you'll be very well aware of the ones that are right for you. But following this session, perhaps have a think about one or two of your main energy givers, and those things also that are your main depleters. So how much of these things do you have in your week? Can you make any adjustments to have more energy givers and reduce the depleters in your day or in your week? And then another tool can be to set an achievable goal for yourself. This might feel a little bit like work-related things, because objectives often are mentioned at work and goals, but really it can really help with a sense of purpose and also help with that prioritizing that we talked about earlier, and therefore conserving energy. And sometimes you may have setbacks which are really inevitable and often unavoidable, and setting goals can be a really helpful way of getting back on track. And I'm sure if we've got that long to-do list with lots of things on there, focusing on one thing at a time and setting specific goals can be a really helpful way to get things done. And then also using analogies can be helpful as well. So often this idea of thinking about your energy in terms of a bank account, trying to stay in credit and avoiding getting overdrawn, and also having some savings or trying to build up some savings in reserve just in case the unexpected happens. Or also imagining your energy, say, in terms of a jug of energy. Some activities will top your energy jug up, and other activities will use that energy, so we'll drain that jug. And we suggest trying to keep about 20% of your energy in that jug. So again, thinking, if you're using that jug analogy, how much energy have you got in that jug today, and what would you like to use your energy on? So it can be helpful just to have a consideration of how much energy that you have. And then we've put here really resting, which is really important to get that effective rest. So really resting and getting effective rest is another really important tool with helping with fatigue. Relaxation exercises, although they might take a bit of practice and might feel a bit strange to start with, particularly they can be really helpful, particularly with that cognitive fatigue that Anna mentioned, which is really important. It's often the hardest part for young people. And this tranquility exercise is a visualization exercise, really, which only takes a minute or so to do, and it focuses on the word tranquility. And with practice, some people have found that often just saying the word tranquility can quickly get them into that calm state, because in a way you're sort of rewiring the brain. And there are other relaxation techniques, such as using colours or imagery, that can have the same effect, or even tensing and relaxing some of the muscle groups if you prefer something that's a bit more physical based. So as well as relaxing the mind, relaxation can reduce muscle tension as well, which, as Anna had described, can contribute towards fatigue as well. And other ideas for effective rest are giving yourself time to pause and be present in the moment. You might have heard of mindfulness. And mindfulness can really help with focus and concentration and attention. And it's a really helpful technique also that to help with managing fatigue. And when we've been working with people, and particularly young people managing fatigue, this is one thing that they've found really helpful. So some people have found using particular apps useful, and there's lots of free content on them that can be really, really good to try. Or just having something really simple, like the idea of a snow globe, usually around, it's kind of a Christmas thing, isn't it? But you know, the things that you shake and the snow comes down, and you can create your own version of that by having just a jar of water with some seeds in it and just shaking it up, and then just giving yourself time to observe it while the seeds are settling. So it only takes a couple of minutes to go through, but it just gives you that pause and that chance for things to settle. It can be really effective, and it is really different to daydreaming. You might think, oh, what's the difference between this and daydreaming? But when we're focused on something, studies have shown that the brain is actually more relaxed than when we're simply daydreaming. So having that change of focus on something. And there is also evidence to suggest that art and craft activities can really help with fatigue by resting the mind and having that real restorative effect. So with all these things, they need practice, and it can be helpful to schedule in a regular time, much like taking a daily medication. And then we can use other more simple things as well, like just using an image to help us get into that state of calm or relaxation.
So another aspect of really restorative rest is having good quality and length of sleep. And I'm sure these that we put up on the screen are familiar to you, but just to quickly add in a few things if it's helpful. I can't overstate what a difference it makes actually having very regular sleep and wake up times. So in the work that we've done with young people, I remember one person who simply set her bedtime at 11 and always got up at 7, whereas her sleep had been all over the place, and she didn't sleep during the day. She was exhausted at first, but then gradually began sleeping more and more deeply at night. Then she found she didn't need energy drinks anymore. Then she lost weight. It became easier to be active, and so on. And everything spiraled in a good way into a cycle of health improvement from simply setting an alarm clock. You'll be aware of the risks with the blue light from electronic devices, and as you probably know, you can turn off the blue light, so you can still use the devices, but without the blue wavelength of the light. Avoiding coffee, alcohol, and heavy food, that all makes sense. Chocolate is in there as well. I'm a chocoholic, so that makes me very sad when I can't eat chocolate just before going to bed. Just really trying to reduce your adrenaline in the evening hours before going to bed. So keeping the activity to the daytime, but not exercising in the evening. And things like a warm bath, they're not just relaxing, but the physiology of it's quite interesting, because our bodies trip into sleep as our body temperature drops. I don't know if you've noticed that when you're really tired, you actually begin to feel quite cold. So as you get out of a bath, your body temperature drops. And if you keep your bedroom cool as well, that can trigger you with that coolness into going into a deep sleep quite quickly. And just one more thought about sleeping is what we're really trying to do is stop our brains from associating bed with being awake. Or put it the other way around, we want our brains to associate bed with being asleep. So if ever we are awake, if you're awake for sort of 10 minutes or more, actually getting up and doing something quite relaxing, like reading in a darkish sort of place, and just restricting the amount of time that you're awake in bed can make a big difference. And then going back to bed as you begin to feel sleepy again. So the last thing we want to talk about is just the importance of talking about fatigue with family, with friends, with people at work, to avoid these misunderstandings that we were talking about before.
And when talking to people at work, they're going to be, as you know, unlikely to understand what fatigue is or to know what you might need. So it can be helpful to be focused and specific rather than saying I'm fatigued and letting them know, because they're not going to understand that. So saying something like I'm experiencing cancer-related fatigue and I manage it well, but I do the following things, or I need X, Y, and Z to help me to work more productively. This can be a really more proactive way of leading the discussion and also helping to inform others what you need. And I think people often, when I've worked with them, feel worried by saying this and then tend to, have tended previously to say nothing. But when they actually do have that conversation, it's a really positive discussion.
Okay, so Julie and I are going to bring this to a close now. Thinking about what are the key points in our focus on fatigue. I guess the first one is just validating fatigue. It really is real. It's not in the mind. And as we said before, if you're experiencing fatigue, if you're living with fatigue, you are really not alone. There are always ways that it is possible to improve fatigue. Even if in that layer 1 you can't make changes, there's still layer 2, where dealing with those very, very normal instinctive feedback loops that happen with everyone. There are ways in there with breaking those vicious circles. Simple techniques, the things that Julie has been talking about, really can make a difference, and in several ways. They break those feedback loops, but actually they also help the inflammation back in layer 1. So exercise, stress relief, all of these things, activity, I should say, rather than exercise, stress relief, these have been shown to reduce systemic inflammation in the body. And of course, they're just generally healthy approaches. Things like yoga, walking in nature, singing. These are all things that involve activity and also relaxation, and they are generally good for our health as well as for fatigue. And I guess the last point Julie and I want to make is that this isn't a magic wand business. There's not going to be a sudden change. It takes time, but if you go gently, choose the 1 or 2 that feel right for you, rather than just trying to do everything at once. We're often our own hardest taskmasters, aren't we? And just notice how well you're doing. Even getting through a day sometimes is a massive achievement. So knowing it'll take time, but that you will get there, and going gently.
So just to recap on that ABC of managing fatigue. So we talked about the activity side. So any sort of activity will do. The B of getting a balance. So trying to avoid where possible that boom bust. And C, the conserving energy to make the most of the energy that you have. And then we'd like to add a D. We've been talking about the importance of discussing with others and now hopefully discussing with us. So over to you for any questions or comments that you may have.
Julie and Anna, thank you. That was a great presentation. I think it's probably given everyone lots to think about before they go into their rest period. But as Julie says, we will be joining you live online now. So you should have a Zoom link, and please join us in the chat, and they will be available to answer any questions and to have a discussion with you. Thanks so much.